Hello everyone and welcome to this audio podcast. This audio podcast is part of the Cortex Narrate series. This audio podcast is part of a Cyclone Cascade. This audio podcast is part of a Coachella Blitz, and this audio podcast is part of a Storm Robotics production. In this audio podcast, a little bit in around the etiology, the etiology in brief. So some investigators describe, for example, acute renal failure, acute renal failure as acute kidney injury or AKI, and acute and or chronic renal failure as CRF historically. And these terminologies have been used interchangeably in investigations that focus purely on acute renal failure or ARF. On ARF patients with abnormal estimated glomerular filtration rate or EGFR. And studies or investigations record patients with reduced baseline renal function, normally as less than 45 ml per mil, 45 where the estimated glomerular filtration rate or EGFR is less than 45 ml per min, and some of the many cases that required hemodialysis as a form of renal replacement therapy modality were called acute, were referred to as acute, i.e. potentially between CKD stages 3 and 5, and were associated with higher rates of morbidity and mortality. However, end-stage renal disease or ESRD, where ESRD has in literature has also been referred to as CKD stage 5, is at the severe end of the disease spectrum, where patients require a form of renal replacement therapy or modality, and renal replacement therapy primarily being hemodialysis until a kidney for transplant becomes available, and kidney transplant or renal transplant is a form of replacement therapy as well. In developing countries, CKD has increased, and outcomes suggest that there is much to learn beyond the traditional risk factors contributing to this irreversible, long-standing illness or condition and associated complications. Renal function is established by glomerular filtration rate or estimated glomerular filtration rate. Over the past decade, however, there have been efforts to improve the identification, management, and monitoring in around CKD. Whilst there are 5 stages of CKD, one review informs that acute renal failure also has four categories. So number 1, a vascular condition in which the blood vessels are obstructed. 2, glomerular histological type involving an immune element normally associated with nephrotic syndrome, and proteinuria is where there's more than 3 grams of protein per 24 hours, and edema and hypoalbuminemia, anemia, and 3 tubular involving acute tubular nephrosis (ATN) with impairment, and 4 interstitial, which is not associated with the previous 3 categories. An example could be where there is presence of eosinophils, which may be drug related and cause ARF. Nocturia, anemia, and long-standing issues in around arterial and vascular concerns and nephropathy are all associated with CKD. Acute kidney injury or AKI is divided into 4 stages and are dependent on creatinine, on the biomarker creatinine or serum creatinine results within 48 hours and also urine output. Urine output. That draws this audio podcast to a close. This audio podcast as part of Cortex Narrate series. This audio podcast as part of a Cyclone Cascade, and this audio podcast as part of a Coachella Blitz, and this audio podcast as part of a Storm Robotics production.